it is important to evaluate the quality of your records outside of the context of litigation, to periodically look into your charts, how your physicians are charting, how they're not charting, what they're recording and what they're not recording, and how they're recording things outside of the stress and outside of the hassle of litigation as a pure quality control measure. Oftentimes in big group practices, Dr. A may do things one way, charting by exception or charting by inclusion. Dr. B may record pertinent positives and pertinent negatives. Dr. C may be Hemingway and may write novels about each patient. Dr. D may copy, cut, and paste over and over and over again. We can't ever change the way physicians practice medicine to a large extent because much of that is relying on their personality and their habits. What we can change is how they record their encounters, how they standardize the language that they use, especially across a group practice, and especially in circumstances where an individual patient may not see the same physician at every visit. If an individual patient comes in and sees Dr. A, then Dr. B, then Dr. A again, then Dr. C and Dr. D, those medical records may look remarkably different. And in the context of litigation, those subtle differences, hearkening back to personalities, can have profound implications as to how the plaintiff attorney expresses their allegations of malpractice. They may compare one doctor to another doctor based not on the practice of medicine, but on how they chart and how they record. So it's important, it's critical even, for good practices to periodically do a chart audit, to print off 5 or 10 or maybe 15 patient encounters in a given period of time, and to have the individual physician look at that and to answer the question, if you were sued, does this record adequately reflect what you did and why you did it? Perhaps even as a quality assurance method, in the context of an individual practice, have one doctor review another doctor's charting method, and vice versa, so that everyone sees how everyone else is charting and can standardize to the extent that's possible the manner in which information is input into an electronic health record. That kind of introspection outside of the context of litigation is absolutely important in making sure that when you do get into litigation, your medical records reflect the quality of the care that your physicians provide.